The police have a saying: during a criminal investigation, the clean get cleaner and the dirty get dirtier. I've been investigating you Black Americans, and you guys just keep getting dirtier. I came across an article about the Tuskegee Experiments, which infected Black men with syphilis. And I found out that it was a Black woman named Eunice Rivers who did the actual recruiting. I'm going to now read you some of the information I found. Now, I'm not going to read you the entire article. I'm just going to read you what I feel are the relevant parts. The section I'm about to read is entitled Impact on Race Relations. Rivers, meaning Eunice Rivers. Rivers became one of the first African Americans to be employed by the United States Public Health Service. Thus paving the way for other people of color in this area of service. She was the third recipient of the Ovita Culp Hobby Award, the highest award the Department of Health, Education, and Welfare could grant an employee. The next section I'm about to read is entitled Tuskegee Syphilis Study. Beginning in 1932, Rivers worked for the United States Public Health Service on the study of untreated syphilis in the Negro male in Macon County, Alabama, popularly known as the Tuskegee Syphilis Experiment. She recruited 600 African American men with syphilis for the study and worked to keep them enrolled as participants in the program. In exchange for their participation, the study offered participants free medical care, which Rivers provided. Rivers was the experiment's only consistent full-time staff member. Now, I found that bit of information right there very interesting. Rivers was the experiment's only consistent full-time staff member. In other words, the rest of the people had some kind of a conscience about this. That's what it seemed to me. But the Black woman didn't. The Black woman stayed around. Although the study initially planned to run only 6 months, over time, this endeavor extended to a duration of 40 years. During the entire study, the participants were not informed that the ailment they called bad blood was actually syphilis. When the study started, arsphenamine, salvarsan, and neosalvarsan were the only available treatment for syphilis, and both compounds had dangerous side effects. However, even after the 1940s, when the discovery of penicillin offered a reliable and safe cure for the disease, study participants did not receive treatment. Even after they discovered penicillin, this woman did not treat these black men. She didn't know it. After the New York Times and Washington Post revealed that study participants had been allowed to suffer rather than receiving a known safe treatment, the Public Health Service ended it in 1972. So it was white folks who ended this after they discovered what the hell was going on. They ended it because, in my opinion, everybody found out what the hell was going on. Historians have offered a variety of interpretations for why Rivers continued her role in a project that by modern standards of medical ethics was completely unethical. Keep in mind, we're talking about a black woman. Now the next section is entitled Public Perception. Following the public disclosure in 1972 of the unethical practices associated with the Tuskegee study, Rivers largely withdrew from public comment on the matter. Interpretations of her role in the study have since varied from support to condemnation. Some regard her as a dedicated nurse who carried out her duties within the framework of the study, continuing to provide care to participants. Others view her actions more critically, suggesting she used her education and position to maintain employment and favorable standing while contributing to the continued exploitation of the study subjects involved. Rivers played a central role in both recruiting and retaining participants in the study. Rivers played a central role in both recruiting and retaining participants in the study. In addition to her administrative responsibilities, she provided participants with limited medical care and emotional support. Limited medical care and emotional support. Limited medical care. Limited medical care. Including listening to their concerns, advising on non-hospital resources, offering comfort, and distributing basic treatments such as vitamins. She was instrumental in establishing the Miss Rivers Lodge, a program that offered financial assistance for burial expenses to participants' families in exchange for their continued involvement in the study. So this broad knew they were going to die. And she kept on with it. While the study occasionally facilitated access to care for conditions unrelated to syphilis, it ultimately withheld effective treatment for the disease itself, resulting in preventable death and lasting harm to the individuals involved and their communities. See? A Black American woman, African American, participated in an experiment on her own people, her own men. A Black African American woman. And the thing that really gets me is that I've been hearing about this for years, but I've never heard the name of the person who actually did the recruiting. It was a Black woman. Let me guess, you're gonna say this is Wikipedia, the article isn't true, the white man is lying, right? Everybody that's lying. I've been doing videos on these house niggas, and I'm telling you, these house niggas are dangerous people. These people are never idle. They seem to be always working against Black people in some way, shape, or form. This woman was participating in the destruction of her own men and her own community. You Black Americans, you just keep on getting dirtier.